Resolution 7125, resolution approving a subaward amendment with Ethiopian Tewahedo Social Services for family and school engagement services, an increase of $50,400 for a revised total of $130,400.
This resolution will approve agreement with Ethiopian Tewahedo Social Services for family and school engagement services. ETSS is a focal point of integration for immigrants, refugee families, and low-income individuals in Central Ohio, helping facilitate their integration through education, training, supportive services, and self-development opportunities. Helping new American students and families effectively engage with their schools is another critical part of their mission. ETSS conducts group and individual information sessions to promote family engagement at school using culturally and linguistically appropriate strategies. Their bilingual program liaisons have proved key in bridging the gap between families and schools, helping to connect with families through home visits, phone calls, and in-person meetings on school grounds. The liaisons also assist with various school challenges, including enrollment, athletics, extracurricular activities, the parent portal, and attendance. Liaisons also work with school team members to connect families to culturally responsive services and community resources. During the previous war periods, ETSS served over 750 English language learners, consisting of students and families enrolled in a local school district. Under this amendment, ETSS plans to provide services to an estimated of 900 English language learners, students, and families. This resolution supports the goal, number 11, of the Rise Together Blueprint, increasing the number of students at or near the poverty level experiencing academic success. Pending any questions, I ask for approval of this resolution.
Madam President, may I please?
Yes.
Joy Bivens, Deputy County Administrator of Health and Human Services. Thank you, Commissioners. Just really quick, since we are talking about a resettlement house, I just wanted to let the public know, as well as the Commissioners know, we understand that there is a cease and desist effective 1/24 that will impact some of these supportive services that go into the resettlement homes. Your Franklin County Health and Human Services teams work collectively together to look at data and operations in these organizations. So when we leave today, we will be looking at what it will be disrupted due to this act and figuring out how we can be supportive in the areas in which we can that are aligned with the federal government. So I know we have received several phone calls of folks in distress and really people concerned, as they should be, but please understand, as we are providing supportive services to the community, we look at data. Data supports why we serve, who we serve, and many times that allows us to put those targeted universalistic approaches around certain subgroups. In looking at this, we will be providing with the commissioners an outline of what services will be disrupted, who in the community will be impacted, and the data that supports it. So Assistant Barnes, I'm going to ask you and your team to work with the collective team of the Human Services team. We can work with your policy people, but we will ask that any information that you receive, you will keep the Health and Human Service Agency in the loop. Thank you.
Madam President,
Yes. Yeah.
Thank you. Thank you, DCA Bivens. I think what's important is I want to make sure that we're all working together, that we're not taking a vacuum approach. I called the initial meeting actually with those settlement agencies, and Dr. Celeste was one of them, because of our establishment of the New Americans Advisory Council and being ahead of this. And we actually had maybe a month before the election started organizing around just being reactive. I think it's so important as we huddle up in our various agencies to not do it in a vacuum. So I want to encourage you to include all the agencies, and really just the New American Advisory Council, because it's representative of really, it's a Congress of the settlement houses and of the different agencies that have human services impact. And so I'm responding to an email from them as we speak. And so it's just important that we keep them at the table and really think strategically. And DCA Bivens, with you at the helm of that conversation, I feel real confident we're going to figure out. So I think it's a great thing if you personally engage in this, because it's a complex, there were people who were in the queue already. They were here in settlement houses or already in the on the way to the settlement house that are kind of in limbo right now, and these are family members of people who are already here. Some of them children, some of them family members, you name it. And so we really need to get our hands around this and figure out the right scenario for Franklin County to support and handle some of these folks. So I just want to encourage you, Chelsea and Katie can give you our list, if you don't already have it, of the, it's just the New Americans Advisory Council list essentially, which is our creation, the county's creation. So I think this is what it was created for this type of crisis and this kind of scenario. So I just want to encourage us to utilize that as these conversations are taking place internally.
Yeah, and Commissioner, we're just doing a reconciliation of what was being funded with those ETSS dollars. I call them ETSS dollars, but I know they're not. There's really only one county in the state. I think that's 5 counties that receive those dollars, to see how many dollars were being taken, and then what is gonna be the impact, and then we can connect with those folks. But we want you all to see the dollar amount and what services are going to be taken away, just in case folks call into your office and they're wondering what happened to their service. But we will definitely work with that group.
And I think we know that. I mean, to be honest with you, I think, because I was just looking at a text last night with what the projections were and what that is. And so again, I don't feel like we need to do anything in a vacuum, that there's an opportunity, at the end of the day, we all want the same outcome. So I just, want to make sure that all resources are being considered.
President Crowe.
Go ahead.
I want Kenneth Wilson, County Administrator. We are trying to get some clarity around the OMB memo that was issued on behalf of the administration. The one thing we have been able to decipher is right away what's footnoted, that this freeze doesn't impact direct aid to individuals, nor is it supposed to impact Medicare either. But if refugee support service dollars, I see those as direct service to individuals. They just happen to go through our settlement agencies. And in our county, these dollars have been extremely valuable to support these organizations, given our large number of resettlement efforts. So we are going to try to have to figure this out. It's definitely going to impact our Justice Policy and Programs Unit as long as this freeze is in place, because it's clear that it impacts those grants that go to our nonprofit community partners. That is clear. What we have to get an assessment of is just how wide reach that will be. We know it's going to impact our Job and Family Services Department for sure, as long as this freeze is in place.
And if I just might add, I've been in communication with Guadalupe Velasquez, and I know that they are working on a Central Ohio Rapid Response Network and working on developing an app, a multilingual app for community members and organizations who are working with immigrants, refugees, and asylees. So there will be a public announcement coming forward on how to help navigate what's happening and resources.
Okay, if there are no further comments or questions, move for adoption of 71-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yeah.
Commissioner Crawley?
Yes.
Resolution 7125 has been adopted.